Today, I'm going to be talking about concussions. Concussions have come up a lot in some of my recent conferences, and in the field of sports, it's a huge topic right now. And with dancers, it's the same thing. Dancers can get hit by other dancers on stage accidentally. They can have props run into them. I have personally been on stage and a light tree has fallen onto the head of a principal dancer. And then there's the common thing where someone falls and their head strikes the floor. And so I have with me today my husband, Davin, who is a physician and who has treated people with concussions so that he can tell us some of the red flags of what to look for if you are on the stage performing and maybe you're another dancer, maybe you're a stage manager, maybe you are a teacher or a company director. What are the red flags to look for when you should pull a dancer off the stage for their own safety? So to clear up any confusion, we hear the words concussion and traumatic brain injury a lot. And are they the same thing or are they different?
So thanks for having me. It is a common question. Is a concussion a type of traumatic brain injury? And it is. Concussion is a traumatic brain injury. It happens when there's a force that's applied to the head or the body or the neck, and it causes the brain to move back and forth inside the skull. And that can cause changes in the blood flow that goes to the brain, in the neurotransmitters flowing through the brain, and that can lead to symptoms of a concussion.
Okay, so just to clarify, there is a space between the brain and the skull, and it's the brain ricocheting in there that can cause injury. And so that's what we're talking about today. So what would be, if you're on stage or someone in the theater notices that someone hits their head or something happens to where their head is struck, what would be the red flags of that dancer needs to get off the stage as quickly as possible? Because as dancers, we're always told the show must go on, right? That no matter what happens, you get off the floor and you keep performing. When is that a really bad idea?
I think the most important thing is for everyone to recognize that a concussion could have happened. So if you do see someone hit their head, or if you see someone take a fall, that should be one of the first questions that should enter people's minds is, oh, is that person okay? Could they have had a concussion? And the things to watch out for that would warrant immediate pulling that person off of the stage would be things like if they've blacked out or lost consciousness. That's probably the most serious one.
And I'm sorry, is loss of consciousness, is there down for the count, or could it be just for a couple seconds and then they open their eyes back up?
No matter how long it is or how short it is,
Okay.
Any loss of consciousness would be a cause for serious concern, immediate pulling them off.
Okay.
If you see someone having poor coordination or loss of balance right afterward, they get back up and they're really wobbly if they're stumbling. If they have any kind of tremoring or shaking, or if they're convulsing, shaking repeatedly, that's cause for immediate pulling them off. If they're having any confusion or not making sense or seeming to forget things very easily, or they're acting strangely, acting in an abnormal way, those would be sort of reasons to pull someone off right away.
Okay. And once you pull them off, should they just sit and rest for a bit, or should they seek medical attention?
I think the important thing is to seek medical attention as soon as possible, particularly if any of those really concerning things was seen.
Okay. And just so you guys know, I was at a conference recently where a cheerleading troupe was performing, and there was a young cheerleader who fell off one of those pyramids and hit her head on the floor rather hard. And she was really wobbly, and her teammates instinctively just pulled her up to her feet and kind of were like, okay, come on, keep going, keep going. And the girl was really wobbly. And there was an entire room full of medical professionals just aghast looking at, because we knew how dangerous that was and unsafe for that dancer. So there are times when you trip and fall, the show must go on. But if a dancer hits their head and they're wobbly and shaky and they just don't seem like they're with it, get them off the stage and get them to a medical professional as quickly as possible. In some cases, dance troupes or companies have somebody right off stage that they can see, and that's great. In some cases, they will have to go to the hospital. So just make sure that the dancer gets immediate medical attention to help them be assessed properly. All right, so those are the immediate signs of concussion, and someone needs to seek medical attention. Once they're off the stage, what are some common symptoms that are there when someone has sustained a bad concussion?
Well, it's a good idea, first of all, if you need to, examine someone or have someone talk to them and ask them questions, see what happened, is to take them away from where the activity is taking place into a quiet area where they can rest and be comfortable and it's not noisy so that you can actually get a good sense of what's happened. Common symptoms that people report after a concussion include physical symptoms like headache, nausea, vomiting, ringing in the ears, difficulty focusing their eyes, so it may have trouble seeing clearly.
So visual problems can also be a symptom. Okay.
Correct. They can have cognitive problems, so problems with focusing or paying attention, problems with being able to understand what's going on or follow what's going on, difficulty with staying organized and multitasking, seeming to be very distractible, and then also emotional symptoms. So if they're more irritable or if they're having difficulty with feeling anxious all of a sudden or seeming depressed or really sad, being unable to tolerate any sort of little frustrating things. So those are all symptoms that can happen after a concussion.
And is that immediately, like the dancer's just off stage, or can that happen within 24 hours?
So sometimes the symptoms and signs happen immediately. It is possible for the symptoms and signs to start maybe a few minutes to a few hours later. So up to 24 hours, sometimes even 48 hours later is when the symptoms could kick in. So it's good to be aware of that it could happen in a delayed fashion.
Okay, so after you have the dancer off stage and they have some pretty serious symptoms and they've been assessed by a medical professional, how quickly do most concussions resolve?
Well, the good news is that 80 to 90% of concussions will resolve on their own within 7 to 10 days. So a few days to a few weeks, symptoms usually have resolved in most cases. During the first 24 to 48 hours, you'll want to take it easy. You'll want to not return to the activity. You'll want to let the symptoms subside. And you'll want to be following the advice of your medical professional in terms of what stages or steps to take to be able to return to your activity safely.
So if you are like dizzy and you're having some problems like severe headaches and things like that, obviously you probably would be pulled from performance for a period of time. And also, one of the things I've learned at my medical conferences is physical therapists and medical professionals who treat dancers, especially those that are watching over people in the theater. There's a whole list of rehab protocols out there to follow. And so everyone has different symptoms and they progress at different rates. And so the physical therapists that work with dancers have a whole variety of things to help you get your balance back on track, your vision, so that when you turn your head, you don't get dizzy. And those common symptoms that happen after a concussion can be resolved with the help of the medical team behind you. And so what happens if you're a really determined dancer and you say, I still have some headaches, but my doctor says I shouldn't go back on stage, but I'm going to perform because I feel I'm ready. And so I'm just going to tell my director I'm ready to go.
Right. Yeah.
What do you think of that?
Well, on the one hand, it's good for people to, once they've gotten through that first 24, 48 hours, to be interested to get back to what they were used to be doing. It used to be that it was recommended that you just have complete rest for days and weeks after concussion. Now the studies show that that's actually not beneficial to do complete rest for that long. So after the first 24 to 48 hours, you should be thinking about gradually sort of going back. But if you go too far and go back too soon or get back too aggressively, going right back to 100%.
Against medical advice.
then you could potentially make the symptoms worse, exacerbate them, or you could make them last longer and take a longer time to resolve.
Yeah, and the last thing we want as dancers is to be getting dizzy with performances on stage, and then that would set us back even further from going back fully to our full potential. So just to also say, the guidelines that are being set for dancers are following the same guidelines as athletes. And so that's the nice news, is that there's a lot of research out there. And dancers are artists, but we're also athletes. So it's important to be aware of all these signs and symptoms so that we can help keep our fellow dancers safe, and also if you're in charge of a dance company, dance troupe, that you know the responsible steps to take if a head injury actually occurs on your watch.
And all the information is contained in the 2022 Amsterdam Consensus Statement on sport related concussion. So you can look it up for free on the internet and get all this information that we just gave you.
And the NCAA guidelines are the ones that the dancer rehabilitation professionals are using to help them guide their treatment protocol. Hope this helps.